It's a fact of life that all of women will face. Coming up, we'll have a doctor live in our studio to tell you all the symptoms and treatments of menopause. Gosh, it's a dreaded word for many women. We all know at some time it's gonna hit. Menopause. And today we have Dr. Stephanie Bean, who runs Executive Med Club of Tampa, to tell us what to expect with menopause. Good morning, Dr. Bean.
Good morning, Gail.
You know, this has been a subject that I've been anxious to talk to you about because, you know, every woman has to face it and you dread it, but you really don't have to. Like, what age are we looking at that we need to start thinking about this?
Actually, menopause occurs between a broad range, 45 and 55 years old. But a lot of symptoms can start occurring very subtly from the age of 40, even sooner than that.
So it doesn't just hit you like a lead balloon. I mean, I know it can, but what are some of the symptoms that we should start looking for?
Yes, it can, but it's also a subtle progression too. So there's two distinctions here, two groups of symptoms: physical and the kind of a mental, emotional aspect. So you can have what I call a change in the vaginal environment in terms of vaginal dryness, irritability, loss of sexual desire, to anxiety, depression, feeling emotional labile when you weren't that way before, particularly.
Now, how do you measure for hormonal imbalances? I know some doctors take a swab of the mouth, but I understand you like to go a little bit deeper than that.
Yeah, you can actually do urine, you can do saliva, you can do blood testing. I think it's important that whatever the specialist was trained in and most proficient at gives you the guidelines.
Okay, now, so how common is it to treat with hormone replacement? I mean, back in the day, it kind of got a bad rap, but things have changed because now a lot of times we're talking about bioidentical.
Yes, and even before that, you know, our mothers even didn't get any treatment at all. And we realized that there's health consequences from as you go through menopause. There's a risk of even heart disease as women go through menopause. So we look at now from studies that we're learning more and more about this, that the closer you can replace your hormones with the same type you have in your body, what's called bioidentical, the better that is for you.
Okay, you specialize with men. You have a lot of a huge male basis of your practice. They go through, I guess, menopause, and we go through menopause, but you're encouraging more and more women to come along because it is something that maybe the husband and wife can do jointly.
Yes, I think that there are not as many specialists in the area that look at specifically optimizing hormones and playing detective, if you will, to sort out what are the cause of anxiety. I mean, a lot of times we just think as doctors that it's something mental and here's a medicine, but it can be difficult to wean off those medicines, and to look at natural progression of aging is something to be the first step, I think.
All right, Dr. Bean, as always, thank you for visiting our show.